Hi everyone, I am Mahesh Jayaraman, acupressure therapist, health counselor and co-founder of Sepalika.com. Nephrologist Dr. Jason Fung of Canada is a marked man. In his YouTube video that's titled The Two Biggest Lies of Type 2 Diabetes, he's done the unthinkable. He's taken on the American Diabetes Association and Big Pharma both in one go. According to him, we've been brainwashed to believe two lies. Number one, that diabetes is a disease that you're going to have for life. And number two, that all diabetics can do is progressively increase medications to control their blood sugar over time. Dr. Fung is part of a growing band of brave doctors that includes celebrity names like Dr. Joseph Mercola, Dr. Mark Hyman, Dr. Mehmet Oz, Dr. Andrew Weil, who are all now saying that type 2 diabetes is fully reversible. Take a second, let that sink in. Type 2 diabetes is fully reversible and they're doing it every day in their clinics. These doctors firmly believe that type 2 diabetes is a dietary disorder. So there are just two core pillars and both of them concern diet. Pillar number one, a low carbohydrate, high fat or LCHF diet. All diabetes medication has the self-stated goal of reducing blood sugar. Carbohydrates turn into sugar and if you can't use them, it's then converted into fat by the liver for storage. Logically, if you cut the intake of your carbohydrates drastically, your body will be forced to use the sugar and fats that are stored in the liver. It's that simple. So the low carb part of the LCHF, you're able to appreciate now, right? What about the high fats part? Well, saturated fats like grass-fed butter, ghee and even organic meat with fat on it help you lose weight. Here's how. 1. We feel fuller sooner when we eat fats, and 2. They give us real nutrition in the form of omega fatty acids and fat-soluble vitamins, and 3. They are a steady source of fuel. Here's pillar number 2, intermittent fasting. If you eat 6 times a day like your conventional doctor wants you to, the body always has energy via the food. When is it ever going to get to burn the stored fat? Human beings have evolved to fast and feast. As we hunted and gathered during our evolution, we went for days without food when we were hunting and then we feasted after the hunt. If you keep feeding your body constantly, insulin is constantly present in the bloodstream and is going to try and push the sugar from your food into your cells. This is what leads to insulin resistance and eventually to diabetes. By learning to eat just 3 meals a day, you can retrain your body to use the stored fats and burn them as a steady source of fuel. That's it. Functional doctors who work to reverse type 2 diabetes also recommend that patients adopt a few other practices to support this kind of reversal. Sustainable exercise, stress management techniques like yoga and meditation, and dietary supplements are some of these supporting aspects. So there you have it. The secret is out. MDs are saying that type 2 diabetes is completely reversible. Agreed, it's certainly not as easy to implement as it sounds. We build our entire lives and personalities around the meals that we have with our families. It's a big part of our social lives. So it's not easy, but it can be done. There are patients who are doing it, supervised by doctors. That's why we are so excited. We have created a comprehensive 360-degree resource library on Sepalika.com for type 2 diabetes. It covers all aspects of the functional medicine approach to reversing type 2 diabetes. We have diet principles, we have meal plans, we have LCHF recipes, exercise plans, yoga videos, how to cope with the side effects of your current diabetes medications, and finally, even research-backed dietary supplements for type 2 diabetes support. Go ahead, learn more about your disease so you can take it head on and win. As always, we wish you vibrant health and well-being.